Hey Aaron, so you've come here, we've done a lot of dentistry for you, we fixed all of your cavities, but you've had joint problems. What we're seeing that around the gum line there's breakdown of your teeth. These are called abfractions. We see them on the other side too. You've complained because your teeth are sensitive, and when the roots of our teeth are exposed, then we feel sensitivity. Normally this happens because we have recession from periodontal disease or bone loss. But in your case, you are a severe grinder. And we see that you've worn down your teeth in a lot of areas, such as right here. Such as the canine on this side. Look at that, that's a lot of wear on this tooth. So the way to see what is really going on is to check and see where your joints reside when they are in their stable anatomical position. And then we close you down and we see, do the teeth fit together or not? And that's exactly what we're going to do for you right now. So right now I'm just going to gently guide your lower jaw so that your joints are in their home position. And as I close you down, right there, your tooth is touching. Your tooth is touching. It's right here, isn't it? Okay. But if you notice, your teeth are not fitting together. There's a space between all of your teeth. Now you can get all of your teeth to fit together as you normally do when you bite by engaging your muscles. And the moment that you do that, we will see that your teeth will slide forward and fit together, but that means also that your joint is coming out of its home. So right now we're in joint position and I've closed you down. Now squeeze closed. There. See how your teeth shift forward? Yeah. So one more time. I'm going to gently guide your lower jaw so your joints are in their home or their reproducible position. When I close you, you touch somewhere here. But when we look at all of your teeth, there's a gap between all of your teeth. Look at that. They're not fitting together. In a moment, I'll ask you to squeeze closed and we will see your lower jaw slide forward and your teeth fit together. Go ahead, squeeze closed. That was a big slide. One more time. Joint position, squeeze closed. Yeah, quickly, squeeze closed. That's a big slide. So your joints aren't staying at home, or they're not even getting to go home, especially in your sleep, because the teeth fit together like this. So now we have made you an orthopedic appliance. That means we've made you an appliance that fits your teeth, but that guide your lower teeth or your jaw so that your joints, your TMJ joints, can go in their home position. Let's try it in. Open, please. Okay, now, as you close down, go ahead, close down, slide forward and back. Good. Now, I'm going to do the same thing again as I did earlier, except this time with your appliance in. Okay? Here we go. Now, squeeze. You're squeezing, aren't you? Mm-hmm. But there's no movement of your teeth. That means that your joints are at home and all of your teeth are stable. They are all resting down on the appliance simultaneously. There is no misalignment of your joints versus your teeth positioning anymore. More so, the moment you slide forward, all of the back teeth separate. Slide forward. Look at that. Look at this side. Slide forward, the back teeth separate. Slide back. Slide forward. Back teeth separate on both sides. Back down. Now, slide your teeth to the right. Look how the back teeth separate on both sides. Go back down. Slide to the left. All back teeth separate. Go back home. The significance of your back teeth separating when you make any sort of movement is very important. Because as long as your back teeth, as long as your molars, your posterior teeth are not touching, then it is impossible for you to engage your major clenching muscles. In other words, when you separate your back teeth, you are completely shutting off the muscles responsible for bruxism. So you're protecting your teeth, you're protecting your joints, and you're protecting your muscles. The tension in your muscles will go down, the inflammation in your joints will subside, your teeth will be protected, you won't wear them down, you won't shift them, and these abfraction lesions that are taking place around the gum line will not continue. Individuals that have had these cavities or these abfractions around the gums, what they will do is they will either get a gum graft or they will get fillings. And later they will discover that with time the fillings pop out. And the reason for that is because the grinding or the bruxism is not dealt with, and the patient continues to grind their teeth bend and flex side to side, and just as the enamel has chipped in your case, then the fillings will chip and eventually pop out too. With this, you're going to sleep better, your teeth, your joints, your muscles will be protected, and your airway will be slightly more open for easier breathing.